Hello, I'm Danielle, as Louise mentioned, and this is Heather. And we're going to talk to you today about the importance of chronic care management. We're going to try to keep it pretty informal, so if you have questions during the presentation, feel free to just raise your hand or holler out and we'll try to address them then, but there is some time at the end too for question and answers. So this first slide is actually the Center for Medicare and Medicaid's definition of chronic care management. And what it says is the chronic care management is care coordination services done outside of the regular office visit for patients with 2 or more chronic conditions expected to last at least 12 months or more, which places the patient at risk for death, acute exacerbation, decompensation, or functional decline. These services are typically non-face-to-face and allow eligible practitioners to bill for at least 20 minutes or more of the care coordination services per month. This next slide talks about the key components of chronic care management. And our sole purpose is to make it a team-based approach. And by that I mean we want the patient involved, we want the family involved, we want the physician involved, and we want to be involved. We want to develop a plan, meeting you where you're at, what you understand now, kind of set goals in the plan to try to get to those goals. We want to educate on signs and symptoms to monitor for, and then as the program progresses, we could take a look and see our progress, and then we can revise that goal and that plan as we go. Some of the things we focus on are closing the loop, and by that we're referring to a lot of patients with chronic conditions have more than one provider. So they have a pulmonologist, they have a cardiologist, they see a specialist for this, that, and numerous other things, and we want to be kind of the bridge that gaps that care. So we want your primary care provider to be aware that the cardiologist just ordered this set of labs, and it kind of prevents duplicate testing from you having to go here and go here, and we try to kind of group it all together and make that more accessible for us to look and see kind of where your care is headed and what's going on. Know your numbers. What we're referring to there is a lot of times you'll hear we want to get your cholesterol down, or we want your hemoglobin A1C to improve, but we don't know what, or you don't know necessarily where you're at or what your goal is. So we like to educate on, say your hemoglobin A1C is out of 14. What does that mean? Where do we want it, and why is it important? So sometimes if you can understand what the numbers mean, establishing that goal is a little bit more achievable. Medication adherence counseling, same kind of concept. A lot of patients take medication, they're not exactly familiar what they're taking it for. We want you to be aware why you're taking this medication and why it's important that you're compliant taking it. And then action plan, that's kind of like the big picture, what our goal is and how we're going to achieve it. And we want to kind of help do those things.
If you want to stop right there for 1 second.
Yep.
So again, we're just going to be kind of informal, and so I'm going to interject right here the medication adherence counseling. So that's a really huge piece for a lot of our patients. They take multiple medications for multiple conditions, and again, they don't always understand what the medication is for, what it's supposed to do, side effects. So I actually just had a patient this morning in the office. I was going through her medication list with her, and she said, oh, and the potassium, I don't take that anymore. Her rationale was she didn't like the size of the pill. She did read the instructions, which do say you can break it in half, dissolve it in water. She tried that. It doesn't dissolve all the way, which it doesn't. But it gets it down to a smaller granule that's easy to swallow. So she didn't care for that. And she just said, I never took it before, and so I'm not taking it. So a lot of times potassium is super important. And so those are the things that we're trying to help with. By not taking that potassium, she could end up in the hospital with a level that's extremely low, now causing another cardiac issue. So that was just, I thought, a good example about the med adherence counseling. It's not that patients are just downright non-compliant with their medications, but if they don't understand the importance or what it's actually doing in their body, they're just not that concerned with not taking it. So.
This next slide is one of my favorites. It says here, care coordination is an important part of a complex care management to help guide patients through what can be a confusing and overwhelming health system. So as I keep clicking, you're gonna start seeing arrows. And in the center, you see your PCP, and then you kind of see some alternative medicine around it. And we understand that healthcare can be extremely overwhelming. And I think this slide does a good job depicting that. You can't tell if it's going left, right, under, over, and we kind of want to be like that added support to kind of guide you through that system. Heather and I have been we've gone in the last couple of weeks to a couple conferences, and this was one of their analogies that they used. Living with a chronic condition is like piloting a small plane. We don't try to do that ourselves. So our goal is to kind of help guide you through that. So on the left-hand side, it talks about what a pilot needs to get safely to their destination: flight instructions, preventative maintenance, safe flight plan, air traffic control surveillance. And on the right side is a comparison on how we can easily, more effectively manage chronic conditions: self-management support, effective clinical management, treatment plans, and close follow-up. So our goal ultimately is to change this paradigm shift from your doctor or nurse telling you what you need to do and calling you compliant when you don't do it, to engaging the patient, understanding where they're at, and then helping guide them through the process of success. And one of the things that we do is health coaching to try to guide that process. Some of the health benefits to health coaching are that it teaches the patients, the families, the caregivers how to self-manage their condition. Health coaching guides the patient to gain the knowledge, the skills, and the confidence to become informed, active participants in their own care. And then Heather's going to talk a little bit more about self-management support.
All right. So self-management support is actually a huge part of what care coordination was designed for. It's really important that we now recognize our patients are actually the best people to take care of themselves and to tell us what's going on, what's going well, what's not going well, and we're more of a guide now. Like Danielle had said on the previous slide, it used to be the doctor told you, what you need to do, what you need to take, what tests you need to have. It's really, we're making a shift in healthcare to be more a patient-centered approach. So a lot of times what we had seen in the past was we tell you to take the potassium, you go home, you try it, you don't like it, and then you never tell us that you didn't take it. And here this whole time we think you're taking it, things are still not going well, we're trying to figure out, we maybe then add another medication. We're just really trying to open up that communication, get our patients talking to us more, and learning how to self-manage their own chronic conditions. So the goal of care coordination is not to enroll you into our program and to keep you there for life. Our goal is to enroll you, work with you on some goals that you're setting, whether that be to improve your blood pressure, get your glucose normals or glucose in a more normal range if you're diabetic, things like that. And how are we going to do that? How are we going to work towards that? It's no longer us telling you, well, you're going to take this medication and you're going to exercise 3 times a week, and then we'll go from there. No, we do more of an assessment, a care plan. We reach out, we see what your goals are, what's important to you, what do you feel like needs to be worked on first. And we work through those goals. Hopefully in the meantime, you're learning some good behavior changes. You're maybe more compliant with your medications because you understand them better. And then, we move you on and maybe hopefully back out on your own and discharge you from the care coordination program. That's really the goal of it. So self-management support, we emphasize the patient's central role in managing their illness. Assess for your beliefs, your behavior, and your knowledge. Again, what do you know about your disease? What do we need to help teach you? Where do we need to go from there? And then advise the patients by providing specific information about health risks and benefits of change. My patient this morning who didn't want to take her potassium, just by identifying some of the risks of not taking it, she's probably easily going to make that change to taking it, which will hopefully, prevent anything else from happening in the future, like an ER visit or a hospital stay, because her potassium level got too far off. Not sure what just happened there. And also our goal is to assist patients with problem solving by identifying personal barriers, strategies, and social or environmental support. I can give you an example of a patient I started working with 3 years ago. He has several chronic conditions. They were all very out of control. He was not controlling them well at all. He was also homeless. He didn't have regular food intake. He had a whole slew of like social or environmental things happening that we really needed to address first before we could even move on to those medical things. And so he's much more stable now. He went from 50 ER visits a year to 2 or 3. He's actually doing some preventative maintenance stuff that he wouldn't have been doing. So it's not just about looking at your disease and what medications you're taking. There's so much more to it when it comes to being able to manage your own illnesses. And then again, arrange that specific follow-up plan. So that's a care plan that when we enroll you into the program, we develop the care plan with you. And again, we're gonna do our assessment, and then we're gonna ask you, like, what is it that you wanna work on first? Self-management is the individual's ability to manage symptoms, treatment, physical and social consequences, and lifestyle changes inherent in living with a chronic condition. Are we going to promise to be magical and clear up your chronic condition? No. We are just going to hopefully help you learn how to manage it the best possible way that you can, and keep your quality of life as high as it should be or could be, instead of maybe being in the ER multiple times or in the hospital multiple times per year. Self-management support, again, is just working with the care coordinators who are working closely with all of your other providers to make sure that we're all in on that care plan. We all know what we're working towards, so we can work towards that together. And then the self-management tasks are to take care of the illness, carry out normal activities. You want to go golfing twice a week. You've been struggling with that lately because your knee is giving you pain. Well, that's something that will help you work around or try to work around or work through, because those things are important to you and to us. And then obviously to help manage some emotional changes. Dealing with chronic illnesses, that's not easy. It's a huge struggle for the patient, the family, caregivers, everyone. So we want to not ignore those emotional changes that come along with it too. We want to address those. Again, just emphasizing that the patient is the center of it all. Your role is key in helping us to help you. We're going to advise you about specific information regarding health risks and benefits. So Danielle and I see Medicare patients a few days a week for annual wellness visits. And one of the things we do during that wellness visit is a health risk assessment. And sometimes the patients are like, well, these questions don't make sense. But it's really just a generalized assessment of how is everything going at home? Do you need any more assistance? Do you need resources? Things that the patients aren't necessarily going to tell us when they come to the office for just a routine diabetes or hypertension visit. But they are things that, if they're not going well, they could definitely indirectly impact your health. And so we want to know about those too. So that's one of the things with our patients in the care coordination, we definitely assess for that. We look at the whole picture. Maybe something that's really important to you is going to church every Sunday, and you haven't been able to do it for a month because of these headaches that you're having because your blood pressure is not controlled. We're going to work on the blood pressure and getting that down, but because we want to hit that goal of getting you back to church on Sundays, because that's important to you. And then certainly with any personal barriers, things at home, maybe that we need to help you look for some resources to get more safety things at home. There's just a whole slew of things that we help with. And then obviously, again, arrange a specific follow-up plan. We're really big on this care plan because this is what we need to follow for our specific patients. And it's different for every single patient. We don't just have one care plan that we follow for everyone. And ultimate goal too for us is to help reduce hospitalizations and ER visits. I've mentioned that a couple of times. And so sometimes, again, it's just us educating on specific signs and symptoms to watch for. We have a couple of nice tools that we use with our congestive heart failure or our diabetic patients. It talks about like yellow flags up there. It is. There's a green zone, a yellow zone, and a red zone. And when you hit that yellow zone, we want you calling. Call us, call the doctor, call whoever. It means something is going on, that you're heading maybe towards an exacerbation of your illness. If everything's going well and you're in that green zone, everyone's happy. So like with CHF specifically, we might teach you, weigh yourself daily. If you're seeing a weight gain of 3 pounds, that's when you need to call right away. And we might also have set up with you, you're also going to take an extra furosemide or Lasix at that time, and then give us a call, because Lasix. It's a diuretic that patients take. So typically when our congestive heart failure patients are seeing a weight gain, it's extra fluid that their heart is having trouble pushing around and processing, and an exacerbation of that can easily land you back in the hospital. So we're going to teach them, watch your weight every day, call us when there's a problem, take your extra medication if that's what we've set up with you. Certainly monitor your salt intake. We know that too much salt retains fluid in the body, and that's definitely something we don't want to do. And then again, taking your medications as prescribed. This patient, he takes Lasix, so it's really important. Yes?
Oh, I didn't mean to stop you that sentence.
Okay.
But I'm not sure if I have these details correct, but it's such a dramatic example for everyone here. I think you had a patient that was coming to our ER twice a week for weeks in a row. You got involved with him, and he was able to stop that cycling.
Yes. Correct. And that's what we see a lot, because we actually target our patients that we see over and over in the hospital or in the emergency department to see why is that happening? What is not controlled? What's going wrong that they're not able to take care of their own chronic condition at home? And so a lot of times, I think I remember the patient that you're talking about, but it ended up being more of a physical barrier for him than anything to actually do specifically with his chronic illness. But because of that barrier, it was preventing him from doing what he needed to be doing, and he was in here quite a bit.
And then you had another diabetic patient who was totally non-compliant, and you turned him around completely.
Him or her? There was a, oh, yes, we did have a, do you want to?
So the nice thing about it is when we can see that there's a problem that continues to happen repeatedly, there's usually a rationale behind it. And when we can pinpoint what that rationale is, we can set up a process for them to follow outside of the healthcare system to prevent exacerbations or shortness of breath when you're retaining too much fluid. So if we can give them parameters to follow, try this if this is happening, or try this if this is happening. And then, by all means, if those things don't fix the problem, we want you to come into the hospital, but we want to try everything first before you're having to spend all your days in the hospital or repeatedly coming into the hospital. So we kind of set those goals up outside of those parameters to try to troubleshoot before it gets to hospitalization.
And for some of the patients, Danielle and I might start off talking to them multiple times a week. And then as time goes on and we're working through things and things are getting better, we back off, because again, we don't want to be a crutch. We don't want you to be completely dependent on us to help take care of your chronic conditions. We want to teach you to self-manage so that you're doing a great job without us, but we're still always watching. So yeah,
We're
so
always there if you have a question.
exactly.
And not feeling like
Right. And you in the purple had mentioned earlier, she comes to a lot of the lunch and learns because she likes to hear these things, and sometimes the more you hear them, the more you respond to the information. And so it's exactly the same with our patients. This patient, he surely was given these parameters probably multiple times before. For whatever reason, they didn't sink in. He didn't think they were important. And so sometimes it just takes us to continue to reinforce those things for that light bulb to go off and them to say, okay, you know, I'll try it, and then they see results, and then that gives them motivation to continue to go on. And some of the patients that we've given examples, they've been dramatic, which is always good because it's easier to see your work, right, your improvements. But what we'd love to see is patients who have the chronic conditions, are not this far out of reach yet, who need extreme measures to help get them back in. It's maybe the patient whose blood pressure has been okay, but we're seeing an upward, incline in the numbers. We want to grab you and work with you for 6 months and hopefully, just figure out what was that one thing that was making it start to go up again. Or a newly diabetic patient. Even if their numbers aren't completely out of control, it's good to start working with somebody right away. Make sure you've got all the information down, you know what you're doing, and then hopefully we don't see those numbers go out of range. So we definitely see a wide variety of patients.
The patient that Louise was referring to, he had CHF and diabetes for quite some time, and like Heather had said, he had probably heard the same thing that I was educating multiple times. He had been in the hospital, I think, 3 or 4 times in like a 4-week period, and I just continued to reiterate that weighing himself was extremely important. And a couple weeks after we started talking, he was weighing himself daily, and he noticed an increase in his weight. We called the cardiologist. He was able to stay out of the hospital. He made the adjustments to his medications, and it just improves everyone's quality of life. He's not sitting in an ER for 5 or 6 hours, or sometimes even more.
Right.
So
having repeated testing done that, I don't want to say it's not necessary. We obviously, if something's still going on, but then that all comes back normal. It was normal last month. It was normal the month before. It's usually more of a management issue when we see these patients repeatedly in and out of the hospital or the ER, and so they just need more support. But yeah, and so for that patient too, I've had patients in the past with congestive heart failure who, we talk about weighing yourself daily, and we've come to realize that when we're doing these assessments or giving this education, we have to ask super specific questions, because this patient, we may have said weigh yourself daily if you go up 3 pounds, call the doctor, call the team. He might not just tell me that he doesn't have a scale. So if I don't ask, then I don't find out that information, and literally that was a super small fix to, he might have been embarrassed that he didn't have a scale, or maybe he was planning to get one. I mean, those are things that are easy fixes and then can save you thousands of dollars by not having to pay hospital or ER copays. And you're staying at home where it's, better than being in the hospital. Who benefits from CCM? Again, we talked about that range of patients from, someone who has a couple chronic conditions and is pretty well controlled but maybe just needs a little extra support, all the way to that patient who is chronically in the hospital. They really, things are out of control, they're overwhelmed, they don't even know where to start. So everyone really could benefit from some care coordination, I feel like. Certainly the more prescription medications you take, the more overwhelming it can be. And the more providers that are involved in your care, definitely the more overwhelming it can be. That's one thing that we do. We want everything coming back to your primary care provider. That should be your patient-centered medical home. We all should be knowing what's going on no matter where you're having these testing or these appointments. And so, again, we track down consult reports, we track down testing results, all of that to get that right in your chart so your doctor can look at it and see what's been going on. And then certainly if you have any limitations to your activities of daily living, those are patients that really are at a high risk for decline that we like to help out with as well. So If you have Medicare and you feel like this is something that you would be interested in, you can certainly talk with your doctor, ask for a referral. We work with all of the McKenzie health system providers, doctors, nurse practitioners, and yeah, so you guys have any questions or concerns or comments?
Is this a national effort?
Absolutely. Care coordination is really picking up steam. So we started doing care coordination 4 years ago here at McKenzie. We were actually, there was not a program. I was hired to start the program. We got busy. We hired Danielle because I needed reinforcements. And it's just a huge push nationwide. I was just talking with someone today about Blue Cross. Blue Cross has a 2019 initiative to increase their case managers by a significant amount. And we would be considered case managers, chronic care managers. There's all kinds of names for us. But because it's so important, and everyone, all of these insurance companies are seeing the benefit of just having that extra person to reach out, close those gaps, give you what education you need, work on some goals with you. I think another good example that Danielle could share with us is a patient who she talks to frequently, and the goals that you had set with her initially that she wanted to set about the, maybe just caring for herself a little better.
Sure. So I guess I've probably been talking to her since January now, so about 6 months. And she just felt like she didn't have anyone to reach out to or discuss these things with. And so her goals, which might not seem very significant to everyone else, but she said she had no initiative to meet those goals because no one was going to call and ask her if she was working towards them or trying to accomplish them. So now her goals are like weightlifting, face care so many times a week. And so now that I'm calling and saying, how's it going? Are you maintaining those goals? She's keeping them for herself. And she wasn't doing that before because she said no one called to ask me if I was doing it, so it didn't matter if I was,
And she had said she lost a lot of her family members, her close friends, she was feeling kind of alone in this world and really had no drive to care for herself anymore. And it's not that she's not capable or able. She just needed someone to reach out, help her look at some things. And what's important to you that you're not doing right now? What goals can we set? And we make them very specific and measurable. She wanted to do these things 3 times a week or twice a week.
And she has chronic conditions. She actually has a very good understanding of her chronic condition. There wasn't a huge need for me to educate or teach on those. She understood those. It was just the sole fact that she likes the fact that someone's going to be calling and seeing if she's meeting her goals or holding her accountable. And it's made a big difference.
Well, somebody cares.
Yes. So hopefully, after 6 months of that, she's gotten herself into more of a routine. She's feeling better about life in general. And, hopefully we can kind of start to let her go a little bit. And, hopefully she'll continue to thrive without us needing to call her every month or, whatever. But yeah, so again, it's just a real... something as simple as this to that patient with congestive heart failure that's being seen weekly in the ER. Everybody's important, and because everybody has different needs, and just because you're not, in the ER every week doesn't mean that you don't have needs that we can't help support or meet or work on. So.
Do they have a social work department here?
Louise. Yep, Louise is our social worker, and she works with our patients inpatient, and anything that we have on the outpatient side, we reach out to Louise for support. Yeah, and as our care coordination department grows, some care coordination departments at health systems have employed registered nurses, social workers, so as we grow, we're looking at getting another, a social work on the outpatient side, but for now, the most important pieces are the registered nurses who can help educate on those specific disease processes, medications, things like that. But we joke because sometimes we feel like Louise, because we do feel like we're doing more social work on some days, but it's just we do what needs to be done for the patient, and
we try to identify those social needs because, like Heather had mentioned before, so a lot of times the social determinants are very impactful
the most important.
On the health condition.
Yeah. We actually just attended a conference yesterday that was pretty much solely focused on those social determinants. Yep, the transportation issues, the financial issues, just lack of resources, things like that. Those things are huge, and they do impact your health or your chronic conditions, whether you realize it or not.
Are you going to be at the senior fair?
We are going to be at the senior fair. You can find us located in the wellness classroom, which is kind of just as you're coming in the building there. And Danielle and I will be there, and we have lots of other McKenzie team members that will be there, and we're going to be doing a fun raffle.
Another thing that we didn't talk about, but I think is a nice additive for the care coordination program is there's a 24-hour nurse hotline. So Heather and I are very accessible during the work week, and then they provide, once you're enrolled into the program, there's a nurse hotline that if after hours, if you have questions or concerns and you're not sure who to call or ask, you can call them and they kind of navigate through whatever the issue is, and then they would send us a message so we could readdress it in the morning, or if it was emergent, they might direct you to the emergency room. So that's a nice benefit to the program as well. It's not just 8 to 5 Monday through Friday. There's options after hours.
Yeah, we make sure that you're covered.
Some insurance companies have.
Yep. Yes. Yep, you're right. And we like the nurse hotline because if you were to call here to McKenzie, talk to one of the ER nurses, it's a policy that we cannot give you advice over the phone. We need to see you, we need to assess you. Like, that's our risk policy. And it's not a bad policy. But this 24-hour nurse hotline, they have very specific algorithms that they follow. If you say yes, they're going here. If you say no, they're going here. I called it myself when we initially started working with them because I wanted to see, are they going to send a not very sick patient to the ER when I'm trying really hard to keep my patients out of the ER? Or are they going to tell a really sick patient to stay home? And so I called. I was a pretty complex patient when I called. They went through their algorithm. It was a great assessment. They asked great questions. And at the end, their recommendation was that I go to the ER. I was having difficulty breathing. They thought I was stable enough to go by car, that I didn't necessarily need to call the ambulance, and was there any reason that I was not going to be able to do that? So it was very thorough. Like, we appreciate that you can call there and get some very specific information versus calling here and us saying, well, we can't really give you that information. We're open 24/7. You're welcome to come in for an assessment. You don't always need an assessment. You don't always need to come to the ER. And some patients just need someone to give them that reassurance, when it's midnight and something is going on. They just need to know, what should I do? So this 24-hour nurse hotline can give you that specific information, which we appreciate. And then again, they give us a real-time email so we know that something was going on with you, and we can call and follow up and make sure we get you in to see the doc and that good stuff. Is there? Just in summary, which I think we've pretty much covered, the 24-hour access to the healthcare professional. And you have to know too that we have our McKenzie providers are on call as well. Each provider takes turns. They do 1 week at a time. So you can call that number after hours. You can't call for medication refills. You can't call for to cancel an appointment or to schedule an appointment. But if you have something going on that you're having a concern with, they have direct access to your chart and they can help you out. So you can call our providers as well, or you can call the nurse hotline. The coordination of care between pharmacies, specialist testing centers, hospitals. I don't think we touched on the pharmacy very much. That's actually a huge one. We're in contact with our local pharmacies a lot. Patients have a lot of medication questions. There's a lot of misunderstandings with their medications. So And I think that our pharmacies in this community do a really great job at trying to counsel patients, especially when they're given a new medication or something like that. Or certainly too, I've recommended to my patients before, if you come to the ER on the weekend and you have a new prescription filled, you get home and you're reading the literature and it says, oh, you shouldn't take it with this blood pressure medicine that you're on. Instead of waiting all weekend to then on Monday call us or the doctor, call your pharmacist. They're super knowledgeable. They went to school for a really long time, and they're probably more knowledgeable about what that interaction is than our providers even, because that's what they do all day, every day. So don't be afraid to reach out to them. They're part of your team, and that's what they're not just to hand you that bag of pills. We talked about coordinating care between doctor's visits, meaning, usually if you have chronic conditions, we're going to want you to see your doctor every 3 to 6 months, depending on what's going on. Coming in once a year or only when you're sick, that's kind of a thing of the past. If you have a chronic condition, like diabetes or hypertension, and we let you go a whole year without assessing you, it's hard to say what could happen in that year's time. Something that we needed to probably catch 3 or 6 months ago. So, but between those doctor's visits is when you're mostly going to hear from Danielle and I. And again, it's mostly through phone calls. We try to pop in and see our patients when they're in the office, and we'll see you if we're doing an annual wellness visit. But mostly you're going to hear from us on the phone. And I think that's it.
I just wanted to add something to the pharmacy one. You're better off going to one pharmacy
Correct.
than not going to several, because they pay attention to what goes with what and what does not.
Yes, that's a huge point to make. Yeah, that's a great point. If you happen to see, if you're happen to go to Walmart and you're going to Walmart in a couple of different locations, that's okay. I mean, they have a huge database. They're going to see it. But, sometimes patients who are on nebulizer treatments, the breathing treatments, not every pharmacy covers those. That's an insurance glitch that really needs to be fixed. But so our patients for those go to Rite Aid, but then maybe get all the rest of their medications from Sanilac. That sometimes is something that you can't control. I wouldn't say if you're getting nebulizers for a current acute condition, I wouldn't switch all of my medications over. But you could certainly make them aware at Rite Aid, hey, I get the rest of my prescriptions from Sanilac Pharmacy, so if they felt the need to compare or make sure that, there's not going to be an interaction, they could do so. But yes, sticking with one is easier. Another situation where patients might use multiple is if you're using a mail order pharmacy, but you are seen at the doctor's office and you need an antibiotic. You'll fill that here because you don't want to wait 4 days for it to come. We don't want you to wait 4 days for it to come. If you needed it today, you need to get it started today. So, but yes, those were really the only times that you should be accessing multiple pharmacies at once. Do you have a question, Todd?
Well, to add to that too, I was actually a pharmacy technician before I started here, and with that, when you do get newer prescriptions, when you're billing them through, it'll pop up saying that there's a possible interaction with something else that they may have billed for you before. So then the pharmacist can catch that and let you know, hey, there's a possibility of this.
Yep.
So watch for this, or you need to talk to your doctor, or they will even contact your doctor and say, hey, this interacts with their blood pressure medication. Is there something else you want to try instead?
Yeah.
So that helps with sticking with one pharmacy also.
And that's another good point too. If they tell you that there's an interaction, so you really shouldn't take that new medication. Remember, there are a lot of different classifications of medications that can all provide you with the same end result, the lowering of the blood pressure. So don't think, well, I couldn't get it filled because it's going to interact, so I guess I'm just not going to take another one. No, let your doctor know if the pharmacy hasn't already done it, and then that way they can say, okay, we don't want an ACE inhibitor, we want a, ARB or whatever, because that's certainly something that can happen frequently, especially the more medications you're taking.
There's always an alternative. So
Always.
if you ever think, oh, I can't take it because of this, there's another treatment.
And then the same with pricing. We've had patients before come in for a follow-up, had a bad infection in their lower extremity. This is a specific example. And he didn't get his antibiotic because he couldn't afford it. It literally took us a half hour to call a different he didn't have insurance, call a different pharmacy who had it much, much lower. Not all pharmacies charge the same price, unfortunately. And don't think that because you're going to Walmart and they have a $4 list, they're always the cheapest. They're not. So if you ever run into a situation where you can't afford your medication, you have to let us know, let your provider know. Don't just stop there thinking you're not going to be able to take it because it's expensive. There are lots of alternatives we can look at, even if it's a different medication that we need to do.
Absolutely excellent presentation. Thank you, Danielle. Thank you, Heather.
I had one question, like, my yearly wellness visits are with my physician, my family physician. So should I, when my issues ends up being trying to make sure my other doctors who aren't in the same network as my family physician, making sure they all get the reports. Could that be something I could expect to be managed through my family physician maybe?
Yeah, especially if you're recommending or requesting that be done. A lot of times, it's more important that your family physician is getting the outside reports and stuff, but sometimes, there might be something that your family physician orders that your endocrinologist could definitely use that information. Yep.
Now it's the cardiologist, the podiatrist, and the
Yes.
ophthalmologist. All ask me those things, and I haven't figured out a way to make sure they all get the same blood.
Yep, well, and that's because that's a huge issue everywhere, and that's why Danielle and I also, a huge part of our job is to help close those loops and make sure everyone is getting that information that needs it.
Sometimes they will ask, do you want this sent, a copy of this sent
Yeah.
to your regular provider? Of course, you always tell them yes.
I think
That way
there's a
they
big
know.
push too, patient-centered medical home, you've probably been hearing that. I think they're making a big push to try to get all of those external things to your provider because it's easier to manage when you have all the pieces, so.
Yep. And things happen, systems get, broken, workflows change. Even though you're saying, yes, please send it, that doesn't mean we're always getting it. So sometimes you might come in and see us and say, well, I had the information sent to you. We might not have it, but we'll track it down then from that point.
I have a solution for that.
Do
Get a
you?
copy yourself, and then you can just say, here.
Well, yes, that's true.
I have done that many times.
Yeah, we have several patients that will bring in their own copies because they know, not every system is perfect, and yep, that's going to happen, unfortunately. I know, we want it to be perfect, yes. And note too, depending on where your provider is located or what health system they work for, the electronic health record that we use at McKenzie Health System allows us to continually update your circle of care in your chart with your provider. So if you are seeing a new podiatrist or you started seeing a cardiologist, don't be afraid to mention that. A lot of people assume that we just know it all, and as much as we would love to, we maybe didn't get that podiatry report back yet, so we don't realize that you're even seeing them. Because too, we don't always have to refer you. A lot of people self-refer. They just decide they want to see the dermatologist, and they go right around us, which is okay. That's completely fine. You're getting the health care that you need, but at least mention it to us so we can make sure we're gathering all of that data back into your chart. All right. Any more questions or?
Awesome. Thank you.
You're welcome. Thanks for coming, everybody.